Hello, my name is Dr. Rachel Levine. I am the Secretary of Health for the Commonwealth of Pennsylvania. On behalf of Governor Wolf, I would like to thank you so much for your willingness to learn how to use Naloxone to save the life of someone suffering from heroin or opioid overdose. It's important to remember that when someone is having a heroin or opioid overdose, it is most likely the result of a disease. They didn't decide to get high. Their brains actually have chemically changed, and they have a medical illness. And that illness is called opioid use disorder. This is not a moral failing. It is a medical condition, a disease. Now, the opioid epidemic is really one of the worst public health crises that we have seen in recent years. In Pennsylvania, close to 10,000 people have died from heroin and other opioid overdoses in 2016 and 2017. That is more than one death every 2 hours. The Commonwealth uses a 3-pillar approach to address this crisis. These pillars are prevention, rescue, and treatment. Naloxone, commonly known by the brand name Narcan, is the critical part of this rescue approach to this crisis. Opioids are painkillers, and that includes medications such as oxycodone, hydrocodone, morphine, tramadol, and a very powerful one called fentanyl. You may be familiar with some of the brand names of these drugs. They include OxyContin, Vicodin, Percocet, Dilaudid, and there are many others. Prescription fentanyl is a fast-acting opioid that is very strong. It is 50 times stronger than morphine, and if used improperly, can be very dangerous. Now, fentanyl can be prescribed by a doctor to help someone with very severe chronic pain. Patients using this medication are carefully monitored by their physician. Heroin and synthetic fentanyl are opioids that are man-made illegal drugs with no medical use. It is important to differentiate between medical fentanyl and these artificial synthetic fentanyl compounds. Synthetic fentanyl is involved in more overdose deaths in Pennsylvania than any other drug now. Naloxone is a life-saving medicine that revives someone who has experienced an opioid overdose. Naloxone cannot hurt someone and can really only be used to reverse an opioid overdose. It has virtually no side effects, it is not addictive, and someone cannot get high from it. If you give naloxone to someone who is not experiencing an opioid overdose, it will cause no harm. This training video will show you how to use both the intranasal form and the auto-injector form of naloxone. The intranasal spray is commonly known by the brand name nasal Narcan and is one of the easiest to use. And that is what has been made available to Pennsylvanians thanks to funding set aside by Governor Wolf and the General Assembly. If you are a first responder looking for training on using the intramuscular form of naloxone, it is recommended that you take the training available through the Pennsylvania Virtual Training Network. In Pennsylvania, naloxone is available to the public without a prescription from your physician, and that is thanks to a standing order that I issued in 2015. The standing order is intended to make sure that anyone in Pennsylvania can get naloxone at their local pharmacy. Naloxone is covered by Medicaid and most prescription drug insurance at your usual copay. Before you get naloxone, it is important to complete this training course and print a certificate of completion. This certificate will help protect you legally as what is called a Good Samaritan. Carrying your certificate with you will help show others that you are trained to help a victim in need. Before we discuss how to give naloxone, let's talk about the signs and symptoms of an opioid overdose. These include seeing signs of opioid use, or knowing that the person suffers from the disease of addiction. You will find an individual that is unresponsive or unconscious. The individual will not be breathing or will have slow or shallow respirations. The individual might be snoring or making gurgling sounds due to their airway actually being partially obstructed. The individual will have blue lips and/or blue nail beds. Their pupils will be pinpoint. Their skin will be clammy. It is essential to note that individuals in respiratory arrest from any number of health conditions will share many of these symptoms with someone with an opioid overdose. It is very important to look for items that would lead one to suspect that the person is experiencing an opioid drug overdose. That might include needles, empty prescription bottles, or other drug paraphernalia. If the individual has no pulse, they are actually in what is called cardiac arrest, and they need CPR immediately. To check if someone has overdosed or may be suffering from another medical emergency, you should attempt to shake them as if trying to wake them up. You can also shout to see if the person wakes up. If the person still does not wake up, a third step is to perform a sternal rub on the person's chest. To do this, make a fist and rub it over the person's chest for 5 seconds or so to see if they wake up. If the person does not wake up, it is likely that they have overdosed.
Somebody call 911.
First, call 911. Emergency responders need to be called as quickly as possible to assist once the person is revived and to make sure that the person gets the medical treatment that they need. The second step is to give naloxone. To give intranasal naloxone, you should lay the person on their back. Then, remove the naloxone from the box and peel back the packaging to open the Narcan nasal spray. Hold the naloxone nasal spray with your thumb on the bottom of the plunger and the first and middle fingers on either side of the nozzle. Tilt the person's head back and provide support under the neck with your hand. Insert the tip of the nozzle into one nostril until your fingers are against the bottom of the person's nose. Press the plunger firmly to give the dose of naloxone nasal spray. Remove the naloxone nasal spray from the nostril after giving the dose. Now let's talk about using the intramuscular naloxone with an auto-injector. It is also possible that you may have access to intramuscular naloxone that is equipped with an auto-injector. This product is typically referred to as Evizio. The Evizio product comes with automated voice instructions and has a speaker that will provide the voice instructions to you. To use this type of device, follow the automated voice instructions. However, if the auto-injection device does not come with automated voice instructions, please follow these steps. Prepare the device by pulling off the red safety guard. Hold the injector with a fisted hand and press firmly against the outer thigh of the person until you hear a click or a hiss sound. This device can be used through clothing. Continue to hold pressure for a full 10 seconds to ensure that full delivery of the medication has occurred. It's important to note that the needle will inject and then retract back into the auto-injector. Do not look for the needle, as this could put you at risk for injury. After providing naloxone through either the nasal spray or the auto-injector, continue to monitor breathing and pulse. If the person is breathing and has a pulse, move them to their side into what is called the recovery position to protect them should they become ill. If they are not breathing or do not have a pulse, administer CPR and rescue breathing if you are trained to do so. Please remain with the person, monitor their condition, and provide aid until medical help arrives, such as an ambulance, a doctor, or a nurse. It is important to note that one dose of naloxone may not revive the victim. If the person does not respond, another dose may be given. If using the nasal spray, The second dose can be given 2 or 3 minutes after the first dose, and it should be given in the other nostril. Subsequent doses may be given every 2 to 3 minutes until the person responds or emergency medical help arrives. If using the auto-injector, you should wait 3 to 5 minutes before giving a second dose with a new auto-injection device. Subsequent doses may be given every 3 to 5 minutes until the person responds or emergency medical help arrives. When someone is revived with naloxone, when they wake up, they may be disoriented or agitated. The revived person may be nauseous. They may have vomiting, sweating, abnormal heartbeat, increased blood pressure. They can even have shaking or seizures and hot flashes. Please try to keep the person as calm as possible and remain with them until medical help arrives. Explain to them what has happened and discuss that help is on its way. In closing, I would like to thank you so much for taking this important step to be prepared to save a life. We are all first responders in this ongoing fight against the disease of addiction. For all Pennsylvanians suffering from the impact of this epidemic, please know that there is hope. If you or someone you love needs help, please call 1-800-662-HELP to get connected to recovery services. Treatment works and recovery is possible, and we are here to help. For more information on the opioid epidemic in Pennsylvania, please visit our website at www.pa.gov/opioids. To receive and print your certificate, please view the instructions on Train. If you have any questions, please contact the Train PA staff. Act 139, the act that allows people to get naloxone without a prescription from their physician, does not require training. However, training is necessary to ensure that eligible persons are protected from legal liability to the extent that Act 139 provides. The receipt of Department of Health and Department of Drug and Alcohol programs approved training and instructional materials and prompt seeking of additional medical assistance creates a rebuttable presumption that an eligible person acted with reasonable care in administering naloxone.